Welcome. This is Social Impact Live, a weekly conversation with members of the Columbia School of Social Work community. I'm Richard Hara. I'm your host, and I'm pleased to welcome to our program today, well, once again, two guests, Dr. Anindita Dasgupta and also Dr. Dawn Goddard-Eckrich. So Dawn and Anindita, welcome to Social Impact Live.
Thanks so much.
Now, I understand that you're both research scientists with the School of Social Work. Are you both associated with the social intervention group SIG, or different parts of the school?
Yeah, I'm an associate research scientist at the School of Social Work and also the associate director of the social intervention group.
Okay, great. And Anindita?
Yeah, same. I'm also an associate research scientist at the social intervention group and a lecturer at the school teaching reproductive justice as well.
Wonderful, wonderful. So before we turn to our main topic for today's program, looking at racial disparities in vaccine distribution, I was wondering if you could just give us a little bit about your background, academic background, and so on, and what brought you to the social intervention group and the Columbia School of Social Work. Dawn, would you like to lead us off?
Yeah, try to get it in real quickly. I came to the social intervention group about 17 years ago as assistant project director, and then I got my doctorate in health and behavioral studies from Columbia. And I started off as moved into project director, and now I help implement and design interventions. I'm working closely with the Healing Community Study, which is the largest opioid epidemic study in the United States, and I co-direct the Black Justice Group for that, among many other things. So I've done tons of work at SIG. It's been very fulfilling around IPV, HIV, a lot of work around HIV, couples at work, worked with Black women for, the past 17 years, some of the most marginalized ones. So yeah.
Okay, wonderful. Thank you so much. And Anindita, a little bit of a self-introduction, if that's okay.
Yeah, sure. Thanks for asking. So I did my master's in public health in Boston and did a PhD in public health at the University of California, San Diego, where I focused on gendered inequities of health as they intersect with sexual and reproductive health globally. So a lot of work in South Asia, a bit in Central Asia, and most recently with refugee populations in the Middle East, and also a bit of HIV and substance work. So I also have the honor of working on the big opioid study with the rest of the Healing Community Study led by Nabila El-Bassel and many others at SIG.
Wonderful, wonderful. And I think, we've had opportunity in the past to have Nabila and other people from SIG on the program. And I think the wonderful thing is that, beyond the research that you're doing specifically in your respective areas, the way that we're able to sort of leverage that and sort of apply it to new and emergent problems, social problems, even though, past problems certainly haven't been all solved, but this active engagement with the world and trying to sort of come up with solutions to the challenge that we face on an ongoing basis is, I think, such an important component of the work that you're doing, that we're all trying to do. So thank you. Thank you so much. Before we continue, I just want to remind the audience that if you've got questions, to please write them into the chat box so that they can be passed along to us so that we can address them sooner rather than later in the program. We do reserve the last 10 minutes for a Q&A, but we like to sort of bring in questions a little bit earlier and kind of weave them into the conversation if at all possible. So if you've got a question, please be sure to write it in. So, all right, so let's talk a little bit about COVID and what we're facing right now. And we had a chance a little bit before the program started to just talk about. I mean, obviously, this is certainly a public health emergency that's affecting everyone around the globe. And there's been a fair amount of, I think, media coverage about how it's impacting people of color differently, right, than other populations, and the inequities and the disparities in people's access to care more generally, and so on. But I think, and this is an important piece, that there's actual consciousness of this now, more generally, but I don't know that there's that much, or a better understanding of what are the root causes, right, for these disparities in healthcare. Is it systemic? Is it due to sort of individual choice and preference and lifestyles and things like that? So having you here today to talk about these kinds of issues, racial equity specifically in healthcare, and also what this tells us about how to tackle our current issue, which is the distribution of vaccines, right, in an equitable manner, is hopefully what we'll be able to cover in the short time that we have. So just more, generally speaking about these disparities in access to care and so on. Do you want to speak to that issue to sort of lay the groundwork for talking more generally, or more specifically, about vaccine distribution?
Yeah, sure. I can start there. A lot has been discussed around systematic racism, over the last few months, and after, George Floyd got killed and the Black Lives Matter movement kind of, it did really, start a whole new other conversation that other people have been having for years. We just feel like, in this world that we're living in right now, there's a history of systematic racism in this country. There's structural racism. And then we also have to remember that there are also social determinants that determine how people, what their outcomes are. So in terms of the vaccine, Black and brown populations have been significantly negatively impacted by COVID. And a lot of that has to do with, some of the things that I just mentioned, with poverty. I can list a whole long list of social determinants that contribute to that. But the systems that are in place also contribute to inequity, and vaccine distribution and testing even, is something that really needs to be continuously looked at. And with that lens on, one of the things that I'm working on with my HCS work is, vaccine equity in pharmacies, and that's something that I think is really going to help inform communities on where the deserts are, and Black pregnant women, the topic that we're here to talk about today, they make up a portion of that. And we just feel like that, that needs to be addressed. I'm sorry, you got to post.
Oh, no, absolutely. And yes, I failed to mention that we wanted to talk specifically about, the vaccine as it impacts Black pregnant women specifically. So, Anindita, some other thoughts that you have? Sort of looking at the more at this more general background that we have here for the experience of Black and brown people in the healthcare system.
Yeah, I think in general, I agreed completely with what Dawn just said. Of course, everything in terms of the root causes really being centered around systemic racism, and I think, a lot has been discussed. Of course, we would argue not enough, both in the scientific literature as well as, I think, in more advocacy-oriented documents around systemic racism as a driving force for increased COVID rates among specifically Black and brown communities, especially the Black populations. And, as Dawn talked about, this goes down to testing, this goes down to so many different issues. When we're talking about vaccine distribution, we are worried and deeply concerned that a lot of the messaging still does not seem to take into account this horrible history and ongoing systemic racism, medical racism, institutional racism that may result in people who have been oppressed for many, many centuries to not want to get the vaccine. And I can speak more specifically about what that means in pregnancy. I think there are some additional factors to consider there that Dawn and I have been talking about and working on. But just to say that, just to sort of start us off by talking about more generally, we are worried about, if we don't get if we don't address this in some capacity, really actually address systemic racism in vaccine distribution, we will continue to see the same populations over and over again at suffering the most from COVID, and time to stop that.
Yeah. So, yeah, no, I'm sorry to interrupt. It seems to me that you brought up that point that there's a narrative out there about vaccine hesitancy, right? That there are certain people who are, and I saw a wonderful article in The Atlantic where the author was talking about, well, hesitancy is not one thing. There's vaccine dissent, vaccine deliberation, vaccine refusal, and so on. So it sort of shifts the responsibility to certain people for why, but you're arguing that that's not necessarily the case, or that it's more access, or is vaccine hesitancy and so on a real thing, and what should we do about that?
No, it's a real thing. I mean, we have to look at the history. Like I said, there's been centuries of mistrust among the Black community in terms of medication, access to care, inhumane treatment. I mean, we could talk about Tuskegee, but in terms of just Black women, experimented on, left out of conversations, particularly around reproductive health, being experimented on for, different birth control methods. So I think that, we really need to start there. Trust needs to be built before we can, expect people to take a vaccine. But I feel like, the vaccine, of course, it's efficacious, it's safe, I would like to say that. But in order for Black populations to uptake it, those issues need to be addressed, and then the correct information needs to be disseminated to them. I'm not sure that correct information is being given out, or, our social media streams are filled with all sorts of conspiracy theories. We need to get in front of that to address the vaccine issue and address the historical mistrust that has been there for centuries.
Anindita, you want to add to that? It seems like.
Yeah. I mean, I think in addition as well, thinking through sort of how do you actually center the right voices? I mean, the right voices really here are Black voices. And Donna and I can talk a little bit about some work that we're planning to try to support that work. But I also think it's just really important to note that almost every major reproductive health medical organization, American Association, American College on Obstetricians and Gynecologists, Society for Fetal Family Medicine, they have all come out saying that the vaccine should be offered to pregnant people, but there is not, and I applaud that. I think it's very important that it should be offered. But the entire framework around the vaccine for the general population is that it should be a rights-based approach. It should be a decision to whether or not you decide, especially during pregnancy. There are a lot of reasons that people may not want to take the vaccine that are related to sort of the science behind how everything was done. And I'm also here to say, as a reproductive health expert, I do trust the science. I do trust the vaccine. But in addition, I think, how can we have a rights-based approach when we are not addressing systemic racism and the centuries of just maltreatment among Black populations in particular, right? So I think that's one thing in particular, and I see we're having some questions coming in, and we kind of wanted to end with sort of call to action and just sort of recognizing when organizations, whether it's whatever that organization is, our major institutions, when we are advocating around equity and racial disparities and all of this and vaccine distribution, if you don't see the word racism, if you don't see the word Black, if you don't see the word like a color, right? Like these are not bad words, right? Racism represents something not good, but we can say these organizations need to actually start addressing it. And then we can talk about more on other levels. But
I just wanted to add that there really needs to be a targeted approach. Like when we scan the journals that are coming out talking about pregnancy and the vaccine, there's nothing mentioned about Black populations. That's a problem, so those types of things need to be addressed.
So how is your proposal, the program that you've received funding for, going to address some of these issues? I mean, what's in it? What are you proposing to hopefully provide both access to a COVID vaccine for pregnant Black women who desire it, and also address, as you were saying before, some of the systemic issues that have created resistance, reluctance, barriers to actually getting the vaccine. What are some of the things that you've proposed?
I can talk on that. It's a small grant. We're really focusing on providers who provide, care to Black women, including not just OBGYNs, but doulas and also midwives. And we really want to center the voices of Black women, like Anindita said. We want to use a reproductive justice framework, to really address this. And we're not saying that people have to take the vaccine. We want just them to be able to have access to information to inform them if this is a right choice for them. And we're talking about Black women here in America, but, Black women all over the world. So this is applicable, not just here, but internationally as well.
It's 12:18 already, so I wanted to see if we could just bring in some of these questions, if that's okay. The first question was, so what type of messaging can best convince Black pregnant women that the vaccine is safe? And again, I sort of take it that it's not necessarily for us to convince, right? That it's,
should be a choice.
Yes. Yeah. What does that conversation sound like, or should sound like?
Well, I think seeing people who look like yourself take the vaccine is helpful. So we should start there. Having providers who you trust, is also another thing that could be really focused on. And, I've taken the vaccine, and I think, me taking it just in my little network, other people have seen other people like, oh, okay, let me get it. You know what I mean? So I think that's definitely something, but we also need to acknowledge, like I said earlier, the mistrust. And we also have to remember that this vaccine is not for Black people. Like, they created a vaccine, it's being distributed everywhere. They're not saying, okay, this batch is going to go into Black communities or given only to Black pregnant women. That's not what's happening. So I think if people just think about it from that perspective, they will really see that they aren't being targeted specifically. Like, Bill Gates is not coming to kill Black people, if I could say that. It's one of the misconceptions that's out there. Sorry. Mm-hmm.
No, I was just going to jump down to another question. Has any effort been made to change the messaging about vaccine distribution and make it more egalitarian? Have you seen any changes since we first got a vaccine? Was it Moderna or Pfizer? And then now we've got 3 of them. Has it really changed at all, the messaging?
Well, I don't really leave my house, so I'm not sure what on the train or on the street. But in terms of television, it's just the same ads that are coming, from my perspective, over and over again. Anindita, I'm not sure if you've seen that. And that's some of the things that we're going to be looking at with this grant, is like what is out there, like sort of a needs assessment, and then figuring out what needs to be targeted specifically for this population.
Oh, so you've got a needs assessment piece in the grant proposal. What does that look like?
Well, like I said, just kind of seeing what the current messaging is for Black women. Anindita, I don't know if you want to jump in here a little bit and talk about what we have planned.
Yeah, sure. So we have a bit of data collection, and I think that the first question is a great one in terms of everything that Dawn just said. That will hopefully be reinforced by some qualitative data collection. We've gotten funding from School of Social Work, I think this is from the COVID-19 vaccine. I think it's a micro grant. So just want to thank them as well. But this funding the goal of it is to do a little bit of qualitative data collection with, as Dawn said, Black healthcare providers, in addition to white healthcare providers who primarily see Black pregnant people, and sort of understand what hesitancy looks like and what the reasons are for. And if we were to create campaigns or materials, what's the best vehicle to get that information out, especially right now. Is there, and again, how do we not only talk to providers around actually presenting a rights-based approach, and really balancing all of that in addition to just getting the messaging out in the best way. So I think the answer to that question, that first question of, what's the best way to get the message out, to an extent, I mean, stay tuned, we'll find out, right? Like, that's the whole point, is that we need to actually talk to people who are most impacted. And in terms of whether or not we've started seeing messaging change, honestly, we've barely seen messaging around pregnancy and vaccine. I mean, and that has taken time to sort of come to the sort of consensus that it should even be offered, right? And New York is one of the only states that actually offers the vaccine to pregnant people right now. I think DC might be on that list as well recently. So, I mean, I look at this as also a huge opportunity for New York to sort of lead the way to really get our messaging right. So,
but is there enough, I guess, data out there to provide Black pregnant women about, the effects that the vaccine might have on, sort of on over the long term with regard to,
nope.
anything, basically, right?
There is yeah, and I'm sorry, Anindita, and that's another thing. But when you look at, and again, we're not telling anybody to take the vaccine, we just want them to have the information. But when you look at the data on the outcomes of pregnant women who get COVID, I can't imagine getting the vaccine is going to be much worse than that. It's detrimental in some cases. So
the data are really clear about pregnancy and COVID, right? And that's the sort of risk assessment that every provider needs to do very carefully with their patients, right, and their clients. And when I say provider, I also mean social workers, right, public health professionals, the whole list that Dawn described at the beginning. But what we do know is that COVID during pregnancy is very, very bad. It's associated with increased morbidity and mortality. So that's just data, and that's just fact, right? So if you are in a situation where you can actually control your COVID exposure, sure, you can make, that's part of that risk assessment, right? To make that decision, right? But again, that's a decision that there's so many factors that play into that, right? If you've had centuries of systemic racism and seeing all these messages and not trusting the medical system, understandably, that will factor into that decision, right? And so we want to make sure people have the opportunity to get the information that's really out there, that's safe, that's accurate, that's based in actual science.
Well, it seems your proposal really brings together different stakeholders, people in the community, but also providers, clinic staff, and so on. And it brings us to one of the questions that was submitted with regard to what can the medical community do to gain the trust of BIPOC people going forward. Do you think there's something that the medical community needs to do differently to facilitate this conversation?
I think we need an entire other social impact to talk about that.
Maybe a longer one.
Yeah, I mean, it's ongoing, I think it really comes down to just messaging, whether it's through social media, through your individual person, within your community, and just really changing how people view the medical community. I mean, would I have taken the vaccine 10 years ago? Probably not, but I'm taking it now, because I feel like I've received enough information to make me more informed, so that's what we are really advocating for here. And I also just wanted to add that, we talked about how terrible the outcomes are with COVID and pregnancy, but then you add being Black. On top of that, Black pregnant women already have really poor outcomes for pregnancy in terms of mortality. So both for the baby and the mother. So this is, I think, a public health urgent issue.
Absolutely. Yes, Anindita.
I was just going to say, I mean, even from the institutions, from the associations that are talking about the need for equity in vaccine distribution, that's great. But again, there are these gaps where there's no discussion around systemic racism within these major statements. And so that is very disappointing to see. So I mean, in terms of sort of calls to action, I know we're running towards the end of this, but I think, one of the things that we would like to encourage everyone to do is, when you're seeing presentations, when you see presentations, when you see statements from agencies, if you see a peer-reviewed commentary that doesn't specifically talk about systemic racism from a medical association, that's a great letter to the editor, right? To go in and talk about. We all have social media, use your platforms. Let's get those conversations going. And I mean, we all have our own work to do around our own anti-Black racism. So I think this is a great way to start with that as well.
Yeah.
I just wanted to note a comment that we got. Someone in our audience wrote in, I find it odd that the focus is on the mistrust from Black women and not on the accountability and burden of proof on the manufacturer, who us taxpayers paid. I haven't heard much from them about their safety procedures. I don't know why we funded the drug and the research behind it, paid them, and then gave them the patent. So, I'm just curious. I mean, do we need to sort of, I don't know, kind of when we're thinking about this in larger terms, looking at other aspects of healthcare that really need to be sort of, I guess, brought to light in order to really put specific issues like mistrust and so on, on a scale or not. I mean, this is something that maybe, as you're working in your respective fields and also working with our students, I understand there are a number of interns with SIG and so I mean, again, call to action. I mean, how do we tackle these much deeper rooted issues in the way healthcare is provided, the financial aspect, the systemic race, everything. I mean, what are the things that we can do that are going to have some sort of effect in the here and now?
Yeah, I mean, it's a valid question. I don't want to say that person is, but that's the kind of stuff. So pharmaceutical companies need to do a better job at communicating with people. Being more transparent. I mean, it had to get funded somewhere, so I'm not going to address that. Somebody has to pay for it. But, that's the kind of stuff that we're talking about. You know what I mean? So people are like, ooh, where did this vaccine come from? Like, they took all our money and they ran and they're giving us this, just that type of information really needs to be given to regular people, not just people who read journals, not just doctors, but it needs to be translated properly into, layman's language that regular folks can understand and really communicate, and have people who were in the trials come out and look, I'm fine, that just complete transparency, I'm saying, and people who are Black who have been in the clinical trials, Anindita?
Yeah, I think also just thinking about the safety data too and the reporting, I think there has been a push I've seen more recently about since the fact that these were all, I think, approved by emergency use authorizations. So thinking about what safety data are available to the public. I know CDC has their own sort of reporting. There are reporting mechanisms specifically for people who are pregnant and get the vaccine around safety. I have not seen how that gets distributed to the public yet. And so I think that it's a good question. These are good questions to ask, right? And so it's partially, public health's job, social workers' job, it's all of our job, right, to get this messaging out. But to also do our due diligence and research behind what we are talking about. Yeah.
And maybe that's one of the things that we'll do with this grant is close that gap, Yeah.
Well, thank you very much, Dr. Dasgupta and Dr. Goddard-Eckrich, for joining us here today at Social Impact Live. I know you've got other meetings to attend to, so really appreciate your taking the time to stop with us here today. Thank you.
Thank you, Richard.
Thanks so much, Richard. Bye now.
That wraps up our program for this week. Next week, we've got Erica Echevarria, Oviedo Williams, and Jaime Estades to talk about a practice course that they're developing that addresses the dynamics of power, race, oppression, and privilege through simulation-based learning. So hope to see you then. Until next week, take care. Bye for now.